Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. This episode depicts pregnancy loss. Listeners who are sensitive to this topic may prefer to skip this episode. Hello. Today I have with me Sabrina Fletcher. Sabrina is the mother of three with two living children. Sabrina's birth journey includes experiencing a wanted pregnancy that was terminated for medical reasons. The acronym for that is TFMR, which we will be referring to throughout the episode. That experience profoundly shaped her life and inspired her to become a TFMR doula. To connect with Sabrina, you can find her by the handle at the TFMR doula on all social media. Sabrina, welcome and thank you for joining me.
Hi, thanks a lot, Kelly. I'm very honored to be here and to share my story in a space that is for all birth journeys, because even myself, for a while, I didn't know, well, it was a loss. My child isn't here. I had to have a DNC. I had to have a procedure. So is it really a birth? Do I fit? And I feel like I fit. You've invited me onto the show, and it really means a lot to be able to share my story in a place like this.
Yeah, it's really important to me to validate all mothers and recognize mothers of children who are still with us and children who are not with us.
Thank you.
I am anxious to hear your story and how it has shaped your life. So I am going to sit back and listen and let you proceed.
I can begin before the loss. So I had a pregnancy that ended up with my daughter, who is now 10. And that pregnancy was all smooth sailing. I was so innocent and nothing went wrong. And I just thought, oh, this is just the way things are supposed to go. My then partner, he's now my husband, and I even spent part of the third trimester traveling. We were so laissez-faire. It was just, have fun, enjoy each other, enjoy this pregnancy, enjoy this baby. Everything was fine. I was cleared through all the ultrasounds, all the different checks, all of my blood tests. I was 29, 30 at the time. And we even traveled on boats, backpacking, like crazy stuff that I did not do in my other pregnancies. And we both look back and we think we were nuts, really, to be that happy-go-lucky. And yet we were. We were very happy-go-lucky in that birth and that pregnancy and birth. And the birth ended up being, it went pretty smoothly. It was a home birth. We had planned for it to be a home birth. There were two midwives and a doula. So I did have a doula at that birth. And the active labor was about 12 hours. So maybe a little bit more, maybe 14. The contractions started ramping up around midnight, and then she was born at 2 p.m. I was pushing on my bed in what's the position? I'm only thinking of it in Spanish because I live in...
Hands and knees?
No. Your knees are up, you're crouching?
Oh, squatting.
Squatting, yes. Yeah. I was only thinking of the word in Spanish. Because
I can't remember the word in Spanish. I speak Spanish too, and now I got agachada?
Yeah, that was the right...
Yeah.
Okay, good. So you can help me out if I forget.
Yeah.
Excellent. And it was really lovely. My husband caught her or helped catch her, and I had a midwife on each side. I felt the power of the ancestors and all the help of these women and birth workers throughout the ages. And it really was a very magical experience. It wasn't without pain. I did tear, but it was beautiful. There was a part in my labor where it wasn't progressing. And then when I got to the pushing part, something switched because my husband took out his flute. So he's Mexican, and There's a lineage through his grandmother, curandero, healers. He does sweat lodge and massage and other sorts of ceremonies. And he took out his flute and he started playing and singing and saying, "We're waiting for you. We're waiting for you." And we had actually conceived that baby. It was a surprise. We were only dating like 6 months. So I didn't know, where do we stand? Me and him. I didn't know how strong our relationship was, if we would be able to continue, if we were, if we would make it through becoming parents. But in that moment, I fully felt his commitment and I was able to then give birth.
So there's a scientific reason for that.
I imagine.
So studies have shown that the oxytocin, the internal oxytocin, is released when a woman feels safe.
Mm-hmm.
And so also when you feel loved. And so in that moment when you felt safe and loved, your body was able to release that hormone that helped you give birth, which I've had multiple friends and people on this show that have experienced that same thing.
Thanks for sharing that. I'm tearing up. I know that this will be a podcast.
Forgot my Kleenex, but we're going to be tearing up a little bit in this episode. So take your time and you can continue your story when you're ready.
Sure, thanks. My daughter, she was born, no issues. She grew up into a little kid. When she was maybe 2, 3, somewhere around there, she started asking for a little sister, a little brother. Well, specifically a little sister. She really wanted another girl. And I would tell her, well, we can't really choose because we weren't going IVF route where you already know. So I would tell her, well, you can't choose, but, we'll love any baby that comes into our family. They'll be your brother or sister. They'll be your sibling. And my husband wanted to wait more time. I had a pretty rough go after she was born with postpartum depression. And I think he wanted me to be really well and really ready to go into another pregnancy and to be able to face that if I needed to face it again. And he also wanted our younger daughter to be old enough, a little bit more independent because she still, really needed me when she was really, really little. So we decided that we were ready. I mean, we weren't ready. Like, you're never ready. We were ready and we weren't ready. And I took a whole fertility course with, you may know the podcast Fertility Fridays. I took one of her, it's not FAM. She does another method, the Justice method, but still you're checking your temperature and the mucus and all of the signs and you're tracking. So we started doing that. I had my IUD removed, but we were using that method as birth control so that my uterus would heal before then conceiving again and having another child. And during this time, we also decided to get married. So then the time frame got pushed a little bit longer. We thought, even if I was going to be pregnant at the wedding, that would have been fine. We can also wait until after the wedding. And our baby was conceived during the honeymoon period after our wedding. It's really magical that we consciously went into that pregnancy. And I took all of that time to learn about my own fertility, my own cycles, different supplements, nutrition. I was, quote unquote, doing it all right. I thought, I've got this. We're doing it all right. We got married this time. I'm drinking the green sludge or whatever. Whatever it all was, taking all of the prenatal stuff, even the most organic, chelated, there's like all this stuff. But there was something with that pregnancy. Looking back, I know hindsight can be 20/20, but looking back, there was a sense of dread. And even on the night that we conceived her, I could feel her baby spirit, the spirit baby in that form. And this has happened in all 3 of my pregnancies, that I feel them and they ask and I say yes. And so she was there and she asked to come and to be conceived through me? And I said yes. And she said something along the lines, I mean, it's not really like straight out English or sentences. It's more of a feeling. But there was this sense of, but it won't be easy. This was her message to me. And I thought, okay, well, what's easy? You know, I didn't know how hard was going to be in this pregnancy, but I said yes. And I said yes, even to the difficulty that she was expressing in her spirit baby form. And then when we got a little bit more into the pregnancy, there were the ultrasounds and the tests. All of my blood work was fine. So the maternal health side was fine at this point, but I had this dread still of the upcoming ultrasounds. And I've recently been going back through my draft. I'm going to turn this whole story into a memoir just on this pregnancy loss part, on my second pregnancy. And I was reading back on notes and journals and just of that whole time. And there was an ultrasound appointment coming up. And I had mentioned it so many, like reminded my husband so many times that he was starting to get frustrated. Like, why are you reminding me so many times? Do you think something is wrong? Is what he asked me. And I had to admit to him at that point. I said, yes, I have a feeling, but I hope it's wrong. And we went to that ultrasound. There was a dating ultrasound that looked fine. That's like 6 weeks or 5 weeks or 7 weeks, something like that. That one was fine, but it was in the 11-14, and they did actually find something wrong, but not with the baby, that one. They found that I had hematoma. So it's like a bleed, subchorionic hematoma. So it's in the placenta. He showed it to me. The doctor showed it to me on the screen and said could be a problem or it could resolve on itself. He put me on moderate bed rest. He said I could still walk around. I could still go out if it was easy stuff. And he put me on progesterone. So at that point, I thought, okay, maybe this is what we have to overcome. And then when I got home, of course, I got on all the baby blogs and forums and freaked myself out. But there was also a lot of hope. There were a lot of stories that everything was okay. There were other stories that there was bleeding throughout the whole pregnancy. There were other stories that they had lost the baby. So, okay, well, whatever is coming, and I will just have to confront it. And I'll take it really easy. I couldn't carry my daughter any longer. I wasn't supposed to carry stuff. I tried not to cook. We did a lot of ordering in. And the doctor scheduled us for 2 weeks out for a follow-up ultrasound because at the time the baby was measuring small. I think that this has to do with the problem that they found later. But she wasn't at the point in development where he could fully do the 11-14 scan, which they look for different potential markers of chromosomal problems or even the beginning of some other conditions or heart condition. So 2 weeks later, we went in and that appointment is seared in my brain, heart, and body. It just felt very different from any other scan I had ever gotten. And this is my second pregnancy, so I had been through a fair amount of them. But the silence, I just remember the silence and furrowed brow as he was trying to take more and more and more pictures, just so many pictures. And that went on for, felt like an eternity. It could have been 2 minutes, could have been 5. And then he said, your baby, something looks very different since the last time you came. And he started to explain all the different things that he was able to see on the ultrasound. There were 2 sacs, cysts on the back of the baby's neck. And the baby had swelling pretty much all over her. We call her her. We don't really know what sex the baby was, but I'll call her her for the rest of the interview and telling this story. And all around her body. And maybe he would have had an even higher resolution ultrasound, there may have been swelling already in the heart and the different organs. And she was also missing a nasal bone. So all of those markers put together, he said that he had seen cases like these and that most of these babies, almost all, didn't make it to term or really wouldn't live more than a few minutes or a few days. The doctor explained that it could be linked to a genetic issue, or it could have been a heart condition, that sometimes babies at this stage in development have high drops if there's something wrong with their heart. And my baby could have also had a heart condition on top of having a genetic condition. So it could have been all of the above. And it was also there while I was still laying on the table getting the ultrasound that he asked us. It was just me and my husband there in the room. He asked us what our beliefs were. I don't remember exactly how he worded it. He was very kind. He was very kind and he was very open and he did not push either way. And even with his questions, they were not leading. He just asked us what our religious beliefs were on termination. And we weren't making a decision right then. We had just found out, 2 minutes ago. We were still in shock. We were in crisis. We couldn't decide anything right then. And he also knew that. He did not push us to decide. But he also did say that because of the laws, and this is very relevant for many places in the world, if we did decide to go that route, that we needed to make a decision. He wasn't pushing us to make a decision. He was just stating facts of the situation, which is dire. And I asked him what that would look like in this state. So we're in the state of Morelos, which is outside Mexico City. State, province, it's not really a state. The capital area. Its own thing. But in this little state that's right outside Mexico City, he said that it would have to go through a committee, an ethics committee. Like some other people would decide for me. Some random doctors that I don't even know. And he knew who my gynecologist was. And he said, well, you can talk to her and she would have references for you. But since we were in the state of Morelos and because he's a doctor in the state of Morelos, I think that was pretty much all that he felt like he could legally say without potentially getting in trouble, which I understand. His hands were tied and we needed support. That doesn't change the fact that we needed support in that moment. He did also say that if we decided to continue the pregnancy, this was now a high-risk pregnancy, and he would be seeing us every week.
That's a lot at that stage. That was how many weeks?
Well, looking through my notes, I saw that we were at 12 weeks and 6 days on that day. So almost 13 weeks. And he said the cutoff was 14 weeks. So we literally had 8 days to decide. And there are weekends in there. And I didn't know, are there 3-day wait periods, just like crazy places in the US? It's very unfair because, of course, there are emergency health issues that come up with anybody who has a body. And sometimes you need to make quick medical decisions. But with something like a genetic condition, you need more time to research and decide and figure out and learn more and talk to people who live with it, families who live through it, families who lost their children to it. I wanted more information. I spent many nights not sleeping trying to smash all that information into my head over the next few days. But when I left that doctor's appointment, I left with a little sheet of paper that said Turner's syndrome and the whole ultrasound and everything, all the findings, all of that. But
that gives you a label that may or may not be true, but
right. We don't know. And I also asked, is there any way to find out, what kind of prenatal testing could we find out more? And he said, well, you could do an amniocentesis, but you have to wait until you're 18 weeks. And at that point in time, this was in 2018, very early in 2018. but the NIPT testing, it still isn't standard practice here in Mexico. So I know that some other folks who have this happen to them at this point, they get offered the NIPT testing, which is also not a diagnosis, but it can screen and it can give you some more information.
So I know this would just add stress to the situation. You had another child at home. Did you consider going back to the States and finding more information, or is that just completely not a possibility?
I didn't want to give birth or lose my baby or, I didn't know if getting on a plane would like cause a miscarriage either. He's saying this pregnancy is very delicate now and this is a high risk pregnancy. And
I just feel like when people hear stories like this, their brain starts going in that pathway where they're like, well, did you think of this? And did you think of this? And did you think of this?
Yeah.
And so I really want a different level of understanding for things like this, where we can kind of hold space for the fact that not all the options are always available. This is so fast and we're learning so much very quickly, and everybody is trying to make the best decision possible and the most merciful decision possible. And having laws that are very restrictive does not allow for the time to make informed decisions in the way that they should be made in this type of situation.
No, I kept thinking, this is pro-life, that I have to rush this, that I can't even find out what the real diagnosis is, that I can't use resources that are available in other countries or other states or with a longer timetable.
Yeah. And then I assume, and maybe I'm projecting, that your goal was to be merciful to your daughter and to do what would cause the least amount of suffering for her.
Yeah, we had to consider all of the outcomes and sort of extrapolate decades into the future without even knowing, piece of paper with Turner's syndrome on it.
Right.
And this ultrasound and decide now. And I had to consider, I had to go and read all the different stories, read people's different experiences. I found out that high drops can lead to a condition in the pregnant person. The pregnant person can get high drops as well, swelling in their own organs, which is called mirror syndrome. So it really was a high risk pregnancy now.
Yeah.
And my health was at risk. And I also learned that many of these babies, if they do make it closer to term, if they do try and save them, I don't even know how long saving is, if it's just a few minutes, if they can live for a few days, if they have a breathing, so many different factors. I don't know. It's going to be different for each individual case.
Right.
But I was looking at, how extreme my daughter's high drops already was at this very early stage and the other markers that she had. It just felt like insurmountable odds for her to even overcome living through a cesarean section.
Yeah.
And they're not even a cesarean section. It's something called an exit strategy, where they have to open you up. This would be vertically.
Yeah.
And remove the baby and the placenta all at once. And, I didn't know if it would be worth it to my body and her body and everything that was going on to go through all of that trauma just to have her live an unknown amount.
Yeah. And then I think something else that isn't always considered when reflecting on some of these stories and the people that go through them is, how is that going to affect the next child that might be conceived?
The next child. Exactly.
Are we putting that child at risk? Are we making it so that we can't have another child? Which I'm not sure why that's sometimes not considered when thinking about these decisions, but I just want to pose that as something that parents are thinking about, because if you're the vessel for this child to enter the world in a healthy manner, that needs to be cared for as well. Otherwise, it's going to affect the health of the next child also, as well as you and your ability to care for your children. So there's just so much more that goes into this than just choosing in an 8-day span how to proceed with this pregnancy.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, fill in knowledge gaps to make sure that you are fully informed and confident, learn key phrases so you can better communicate with your medical team, emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's KELLYHOF.com/empowered. I'm honored to be a part of your birth journey.
Exactly. We had already decided that we were going to go through with the termination, and we had to cross state lines. We were in Mexico City because I just said no to the ethics committee thing. I said, no way. I'm not putting myself through that. Just no way. And I know that I'm privileged. We were privileged to be able to travel, to be near enough to another state that would see us at that point. And I ended up, it was on the day, like that was the cutoff day, but perhaps the doctors didn't worry because the baby was measuring small, but I think she was measuring small because she was very sick. But we were in Mexico City, and my husband's family is from there, and many of them still live there. And his nephew, who is my age, he's an adult, he is, what was he doing at that point? I think he was in labor and delivery, but he had been in NICU nursing. So he was a NICU nurse. And then they had moved him to labor and delivery nurse. So he knew each side. He knew the baby side, pregnant person side, all the different factors. And he looked over our scans and he heard what the doctor had said to us. And he said, oh, yeah, these babies, if they even do survive to a certain point, you'll have to have what I just explained, the exit strategy. He said, very traumatic to your uterus. He said, if it was me, I would choose this too, also for the health of your uterus, because your first pregnancy was a vaginal, regular, in quotations, what's regular, but a vaginal birth. You can do that again through, helping this baby die and it was a DNC. So they say surgical, but it's not even really a surgery. It's a procedure.
Yeah, and it's one of those procedures that, and I had a doctor come on and explain kind of staging for some of these procedures, but if you're early enough in the process, then it is a procedure that's still an option. And it sounds like you were early enough in the process. So it's difficult, but it's also one of the factors that makes it important to have the option to make these informed decisions early enough to reduce the trauma.
Yeah, I did want to vaginally deliver my baby though, but it was not given to me as an option. Right at that cutoff point, I think in places like Australia and the UK, right around 14 weeks is when they do induce people in these cases. And from around 14 weeks onward, they do recommend labor and delivery. So that's the natural form of the uterus, then through the vaginal cavity. It's, the system. That's the system. So it's not sticking a tool up in there.
Yeah.
I did want to do that. And I thought, well, I've had a regular delivery before, so I know I can labor and deliver her. I know I could. But at every turn, it was no. And no because of this, and no because of that. No because you're early. No because, the laws. No because, it could be 3 days on Pitocin. You still might not even give birth.
Having experienced losses at the stage where they could be at labor and delivery. And just because for the most part at the facilities where I work, we don't have the ability to do a termination just based on our facilities. When I witnessed delivering of the losses, and this is a loss, this was a wanted pregnancy, I feel like there is the ability to have closure and more space to honor that child that has been let go or has, in most of my cases, has passed. And I'm wondering if maybe you felt like that wasn't something you were able to experience because of the rushed nature and the procedures that were available.
Definitely. I definitely felt like that part of grieving was ripped from me and not even given to me as an option. And I would like to argue that your facility may, because of the law, not be able to do a termination for medical reasons, but it's the same. If you induce people through Pitocin, it's the same. And that's another thing, that a DNC chosen, not like I chose it. I mean, it did have to decide and choose, but it wasn't my ultimate choice.
Right.
My choice was to have a baby and then give birth to a baby in whatever way that pregnancy was going to end up. But
the facilities where I work, honestly, I don't even know if it's the law. So I'm just thinking when a miscarriage comes in, the number of weeks that is required to come to labor and delivery versus the main OR. You know what I mean? Because we have to reserve
it's just
space.
different hospital protocol.
Yeah, and it's reserving space. But I have had a patient who required a termination for medical reasons at one of the facilities where I work. And I'm not sure what made it. Maybe it's just providers willing to do it. Because I know that at one of the facilities, they used to actually do it with a certain provider. And I had one provider that did, and I was a nurse. But other than you have to be at a certain gestation to come to labor and delivery. Otherwise, it's something that would be handled in the main OR.
Yeah, very early on, you could take pills to help the pregnancy pass. Or if it's a little bit later on, through 12 weeks, 14, it's a DNC. And then even, 14 to 20-ish, then it's called a DNE. And then after that, most people are induced. Whether or not,
depending on the loss,
the baby has already died or whether it's for a medical reason. They are the exact same procedures.
They are.
It is exactly the same. That was something that I had to tell myself over and over again when I was preparing to go in for my TFMR. And I didn't even know the acronym at that point. Everybody just kept saying, your procedure, your abortion. And I was like, what is going on?
A horrible word.
But I was preparing and I had read just enough on some sites, because some sites take you down this road that's like you're going to hell road.
Yeah.
And I was thinking, I need the scientific explanation of what this procedure is. And then I realized it's a DNC. I've heard that term before. I've had people in the fertility community that I was part of had a regular miscarriage and had to have a DNC. And so I kept reminding myself, this is the same. This is the exact same procedure. And they don't tell women who have had a miscarriage that and have to have a DNC, that they're going to be infertile, that they're going to get breast cancer, that they're going to have depression, that they're going to kill themselves. But we have all these myths about abortion, that all of these bad things are going to happen to you because you chose it, because you chose to have an abortion. But the risks are exactly the same. There are risks for a DNC, for all of these different procedures. But none of those are the real risks.
Right. We also, like, if there's retained placenta after delivery, that's what we use is the DNC. So it's just a procedure that's used for cleaning out the uterus.
Yeah. And it can even be used even beyond pregnancy conditions. Sometimes it's needed for different uterine health things.
So you scheduled your procedure.
Scheduled it.
And then what happened?
My husband did that for me. I couldn't even make the phone call. And it was scheduled for Monday. We arrived Monday. So I'm fasting since very early morning. We had to take an early morning bus to get across state lines and then a taxi to get to this clinic. And the clinic was closed. And so I'm just dissolving in a heap of wails and tears on the street. And my husband is, what what should I do? What should I do? Okay, I'm calling the doctor. We had his direct number somehow. And he said, oh, he had forgotten that it was a bank holiday. But he said, but I'm coming. I'm coming. I'm going to come in anyway because you're there and I scheduled you.
I feel like that is, having lived in Latin America, not a shock, but very poor timing.
The worst, the absolute
but
worst.
But good for him for coming in.
Yeah. And he was very compassionate and he saw us one-on-one. He even had another doctor come in. He said, we can do it. We can still do it on this day. He explained the different steps of the procedure and the medication that I would take beforehand and the recovery and all of those medical details. But I said no to doing it on that day because at this clinic, they also have a therapist. They have a counselor on hand and they have because he had explained, first you see this nurse and then you'll see the counselor and then you'll wait here and then the procedure. And then afterwards you see the counselor again. I wanted that support. I thought, okay, well, they do this over and over. So that part of the support will help me through the process. No. So the next day we go in and yeah, it was very traumatizing to be with all of the other patients. It's just a different case. It's like if you instead of having a miscarriage on the maternity ward, you put them in an abortion clinic. It's just not psychologically the same thing. It's just not. And that's not to say that either of those experiences are more or less valid. They're just very different. So I felt like I was on Mars. Or that I was a Martian on Earth, like I felt like I was an alien, because my husband and I were there and I was crying and I was like holding on to this little poem. And I thought, okay, we'll talk to the counselor and she'll help us with the grief. She was like, grief? I was like, what? I felt like I had to explain to her. And I just felt like yelling, like, this baby was wanted. This baby was wanted. This is a pregnancy loss. This is a pregnancy loss. I'm a grieving mother. I wanted to scream at everyone there. And even the nurses at different parts, they would hand me tissues, but then they would just turn their head, which I understand they're doing their job. And my body was well taken care of that day. My body was. My mind and spirit was not. I had to be alone for the pre-op, had to be alone for the post-op. I was so groggy and out of it when I came out of the procedure. Because I did have probably something like twilight sleep. It wasn't full on anesthesia with the breathing tube or anything like that. But I don't remember the procedure itself. And there are people who do, especially redheads, because
the way they metabolize.
And sometimes people, they get the medication, but it doesn't take away their memories. They still come out of it with their memory intact of the sensations and the sounds and I think that somewhere in my brain, in my spirit, in my psychic body, I think I do have those memories because it does still feel very traumatic. I imagine the things that were said. Oh, do you have it all? Like, did we get it all? I imagine that. I don't really know exactly what was said during my procedure. And then there was another counseling session after, and she was like, okay, now let's talk about birth control. And I just said no. And that was it. We did not have that conversation. So like, I planned this baby. I took a fertility course. I was tracking my we tried for various months. This baby was planned. We lit candles on the night that we conceived her. We prayed over her like baby spirit to come to us. It wasn't a whoopsie.
Yeah. How sad that we don't have the support necessary for these situations in some areas.
It's very sad. And I know that it happens with spontaneous miscarriages too. I know that a lot of the time people are treated the same way. It's a procedure, in and out, take your birth control afterward. It's like, what?
Yeah. And that there isn't necessarily training for the staff for these cases, that they don't actually have a counselor. I mean, and I would imagine that that comes down to funding and, the service that they're trying to provide, which is important. But I just wish that people weren't falling through the cracks when these cases arise.
Me too. I remember sitting there alone in the pre and post-op seat And it was right then that I was like, where is my doula? Where is my doula? Where is the person who can sit next to me and, hand me tissues and be like, it's okay to cry. This is a loss. And I'm so sorry for your loss. Instead of just handing me tissues and like running the other way.
Yeah. I feel for you and people in that situation. I also feel for the nurses that aren't equipped just as a nurse, because sometimes I feel like I'm not equipped. And I just wish that we had resources. There are resources that we could help people tap into those resources to help in situations that are painful like that.
Yeah.
But I'm so glad that you're doing that. I'm so glad that you have decided to make that your journey. And I also wonder if that's what your daughter meant, that it will be hard, but in birthing her and letting her go, maybe you birthed this new journey as well.
Mm-hmm. Yeah. Interestingly, a few years later, on my birthday, I like to get a birthday reading, astrological chart. And I had a birthday reading with an astrologer, and I asked for her to do a joint reading. So you can get a joint reading like with your boyfriend or with a potential love interest. Well, you're supposed to ask for their permission, or with your mom to see like, what's our journey together? Where do we interact? How do we overlap? This relationship that we have together. And this astrologer did this for me and my baby's birthday, because this is her birth story. That was her birthday as well. Although it's really hard for me to call that her birthday. But I did this reading with this astrologer, and that was what came out of that reading. That it was a portal. It was an opening into supporting others through this, but even through very esoteric manners. And that my baby brought that to me, which I found very beautiful. I really enjoyed that reading. And it's helped me remember that, yes, it's okay to bring in spiritual practices. I have a course on mindfulness, mindfulness and grief after TFMR. I also have a bunch of Reiki videos. I do Reiki with my clients too. I did that a lot with myself after, to try and heal the spiritual part of this loss.
It's hard that is how you came to be a part of that journey, and how beautiful that is what your daughter brought to you, and that you accepted that. You accepted whatever hard meant.
I said yes.
Sometimes we have no idea what we're saying yes to.
I had no idea what I was saying yes to, but I would say yes 1,000 times. I would say I would go through that for her. I would choose that for her again and again. I would save her over and over.
So then, was there anything else that was part of your healing journey? Was that primarily how you moved through that experience?
I would say another big part of that was community. So I found these Facebook groups and places and forums where other women, other families, other people had been through this, and they were sharing, even the shitty things that happened during their procedures, or getting the diagnosis, or the grief afterward, what they were doing to help themselves heal. I found out about a therapy that's specifically for trauma called EMDR, eye movement desensitization something.
Programming, I think.
So there's like clicking or tapping, you're moving your eyes, you're activating each side of the brain simultaneously to help put the trauma memories in the proper filing area, in the memory area, instead of active, this is still happening, this is happening right now, flashbacks, because I did have that afterwards. And when I finally found an EMDR therapist, she went over her checklist and I checked all the boxes, and she said, yeah, moving towards PTSD. I think if I would have remained untreated, it would have been full-blown PTSD. So that was really helpful for the trauma part, because the trauma and the grief, they're like dancing together, but they're two separate dance partners. There's the trauma and then there's the grief. With the grief, I also did a lot of art. I do a lot of rituals. I continue to do ritual. I did my own scattering of her ashes that weren't really her ashes, because we didn't get ashes. We did decide that in a way. It was not really a fully informed decision consented to decision, but we didn't get her ashes. But I took a day on what would have been her due date, and I collected sand and I scattered it into the ocean as her ashes, just reminding myself, yes, I did go through loss. Yes, this baby existed. Yes, I did have to make a major life decision for her. I had to make all of her life decisions for her, as parents do. Parents do that for their children. They make medical decisions for their children. But it wasn't just a procedure. It wasn't just my abortion. That's an aspect of it, but not all of it.
And so then how did that affect the rest of what your future family became?
It was very hard to try to conceive again, to get out my thermometer again, to be checking again, to be tracking. Although I was tracking all of my cycles, even through that loss cycle, the pregnancy loss and the number of days that I bled, and then looking for signs of ovulation again. The doctor, we did have a follow-up with the same doctor who gave us the diagnosis, I think maybe about 2 weeks out. So he checked that my uterus was in good health, and his recommendation was to wait 6 months. And he also told us it's more time to heal psychologically than really the body needing to heal that long. And we did take about 6 months before we conceived again.
Did you do the EMDR?
I did EMDR between the time after my loss and before I was pregnant again. And then when I found out I was pregnant again, then the therapist said, at least during the first trimester, we're not going to do any more EMDR sessions just because it's unknown. The risks are unknown in pregnancy. And I didn't end up going back. I really love that type of therapy because it's not like 2 years long and digging into your childhood trauma and looking at your attachment and these people wronged you and you this and these characteristics and digging and digging and digging and digging. With EMDR, I don't remember exactly how many, maybe 6 to 8 sessions. And my flashbacks were like 95% gone.
And you don't have to relive things.
So it was very effective in my case.
Sometimes if someone isn't ready to relive everything and do all that digging, it's nice to be able to just categorize those feelings and put them.
Yes. I mean, the digging has a place, and I have done regular therapy for like 2 years. I have done that too. But for this, it just was not the time. It was not the time for me to go through my childhood, everything. You know, I had just been through a very traumatic loss. I was deeply grieving. It was not the time. Not the time. And I know that some people decide that it is the time, and they find a lot of comfort in therapy. So really, you know, whatever therapy works for people at that time.
And so then how did that third pregnancy go for you?
I was so anxious. I've never been more anxious in my whole entire life. There's a quote that says pregnancy after loss is holding your breath for 9 months. And that is really what it felt like. Felt like I was holding my breath for 9 months. And even once she was born, I was still like, no, she will die from SIDS. There's no way that I'm actually going to be able to keep this child. Something horrible is going to go wrong. I just know it. But that was my anxiety speaking. It was different than the feeling that I had in my other pregnancy. It was full on anxiety. I had to use all of my, what I call psycho-spiritual, like all of my psycho-spiritual tools every single day. So a little bit of Reiki, some prenatal yoga that specifically doesn't say the word baby over and over and over again. Like I had to screen every single video or audio that I was going to use because everything was triggering. Even being pregnant again was very hard because there were the same sensations, the same clothes, the same scans. So getting through those scans it was so hard. I was sure that I would lose her. I was sure that I was not going to be able to take home another baby, to have another baby. A baby that would actually grow up in my household. Looking back on that time, I mean, it's hard to diagnose yourself, but I think I had postpartum anxiety as well. And there were even some compulsions around like her sleep area, you know, like this many inches and like checking again and checking her like 6 times a night. But she's 4 now.
Good.
So,
And you've been working on a lot of those. At this point, I don't know if we call it postpartum, although I think once postpartum, always postpartum, because isn't that where most of our anxiety is stemming from?
Sure.
But is that where you chose to do traditional therapy?
Traditional therapy happened later with relational things that were going on between my husband and I.
Yeah. Been through a lot.
And yeah, we've been through some stuff. Yeah. But I would say today, in June of 2023, we're really good. We're really good, and our kids are really good. And our baby who died, which we named her Clara, she lives on in my heart. Her light shines over everything. I can feel her presence. I can ask her for guidance when I need it. She's still part of our family, although different. It's different.
So this is something that I ask just about everybody that comes on the podcast. If you could go back and talk to yourself at any part of this journey with the wisdom that you have now, is there any key point or points during that journey where you would want to have the opportunity to go back and speak to yourself and give yourself a message?
With the healing modality that I use, Reiki, it's said that it can go through space and time. So I've even sent myself Reiki to that time where I was sitting alone in those chairs. Well, that one chair in the pre and post-op. It would be in those moments. I wish I could go back and be there to hold my own hand or to be my own doula, although that's not really possible. It's always good to have a doula, even if you are a doula. Maybe I would tell her, you aren't, even though it feels like you're alone, and even though this journey is very lonely, you aren't alone. You aren't alone in this. Even though right now they're making you feel like this is the only TFMR they've ever dealt with ever. That's not even true. They happen all the time. They're more common than stillbirth. I would tell myself these facts to try and comfort myself in some way. I would say just keep going one tiny step at a time. You will find community. You will find people who have been through this. You'll eventually be strong enough to build your own community around this, and it will see you through. Other people will see you through. Even if they're not here right now, sitting next to you in this recliner, they're here. They're here.
And like the phoenix, you'll rise from the ashes.
After being burned. It's a burning process.
Yeah. Well, Sabrina, that was a lot to take in. And I really appreciate you trusting me with that story and sharing. Is there anything that we haven't touched on that you wanted to share?
I'd also like to share about my third daughter, that as nerve-wracking as that whole pregnancy was, I was able to get through that labor and delivery, and I was able to have another home birth, and she was born in the water. It was amazing and so healing, and even if she would have been cesarean section, I'm sure that would have been healing too, because I had it all set up around myself. I had a doula that time. I had my community. I had my lost community. There's a monthly thread where other people who were pregnant after loss were supporting each other through this. So I had through that process, and that made a huge difference.
Yeah.
And the point in pushing with that story, what helped me birth her was I went way out into the universe. They say, in birth and in labor, you go way out. I was way out. I was way out past Saturn, collecting her little soul and bringing her back. I was way, way out there. And while I was way out there, I was still so fearful. Like, is she going to be born really sick? How will I be able to take care of her? What if they miss something? What if something is really wrong? And I wasn't able to help this baby like I was able to help the last baby. But there was just this point where it's like, whatever she has or doesn't have, I will confront it. And she was born like 10 minutes later.
Once you felt that peace and that power within you. Thank you so much for everything you do and for sharing this story with my audience and continuing to share with the world.
Thank you, Kelly.
I hope that in time, the shortest amount of time possible, this becomes something that more people understand, because I don't want anybody else to be feeling alone in that process.
That is my biggest hope too.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.